Well, hello there. Welcome to Ensuring Your Well-Being. I am Dennis James, the biking, dancing insurance man, and we're going to have a great topic today. And it's going to be another focus on wellness and its prevention, but at the same time, I have a Dr. Mary Jo Voelpel and a intern, Jessica, learning under her, and we're going to have a topic on the prevention side. She's going to educate you on how important it is with prevention, but at the same time, there's her background. So why don't we start out there and welcome Mary Jo.
Good afternoon.
I'm glad you're here. I know we have things in common. And what is that?
Absolutely. Well, I don't bike anywhere near as much as you do.
Yeah, but you
but
run.
A little bit. Yes.
I would talk to Larry, and you're out there running at 5 a.m, doing training for marathons. But go ahead. Just briefly, I want you to talk about, your lifestyle, but, what's really important is also about, yourself as a professional physician.
So in my profession, I found that it's so important to maintain a healthy lifestyle all the time. It's not something that a physician should talk about. It's something that a physician should do. And in part, our exposure to our patients should be through example. And I would hope that if someone sees me weight training or running in the morning or exercising or swimming, that it makes sense to them that this is the way you help to improve the quality of your life and minimize the likelihood of having what we consider comorbid conditions. As you know, most of us are now reaching the age of 60, 65. Many of us will live to be 80, 85, 90. My mother currently is 99 years old, and activity is important. None of us want to be in a nursing home. None of us want to have problems with dementia. And so to do that, we have to be proactive with who we are and the way we take care of the one body that we have. The first part is making sure that we're mentally active, that you interact with at least 5 or 6 people a day, that you maintain your social contacts, that you maintain a spiritual presence, and you're always stimulating yourself to do different and new things.
Exactly.
For me, part of that difference is like in doing a dance competition. So my husband started to learn how to do the paso doble. So I'm like, wait a minute. You step to the left. No, this one's to the right. No, it's not. It's not a shift your hips. It's standing straight up.
Yeah.
So it's all of these things.
You both have competed, and I know every time I try to connect with you, you're going to some state to compete, you and Larry, and that's pretty exciting. Just from myself being around my background and even teaching dance, I can very well relate to all the benefits of it. Now, how did you get into the profession of being a doctor? And this is with cancer, hematology, and oncology. Is that correct?
Yes. When I was in medical school and then started in the hospitals, I was fascinated by the fact that there are ways in which we can respond to an infection or to a serious illness. And I would look at, why is this person walking the halls and this other patient is laying in bed with bed sores? What is it? And I began to really, without even being educated on it, teaching myself this lack of movement is not normal.
Mm-hmm.
The physical body is meant to move and be active. And when you remove that movement, complications arise. Medical complications arise. And I tell my patients all the time, if they go into the hospital and they have pneumonia, I said, listen, You can have a simple pneumonia and go home and finish out your treatment within 3 or 4 days. Or you can have a pneumonia and you lay in bed and you don't move around, and then you develop swelling in your legs, and then you have a blood clot. And then the blood clot travels to your
Now,
lungs.
is this somebody you're treating for cancer or no?
It can be any condition.
Okay.
I think that we presume that if we have a serious illness like
Hmm.
cancer or kidney failure, that's when you have complications. And that's not the case. I have seen many fellow athletes think they're doing great. They end up in the hospital for a problem. They end up with a blood clot. They freeze. They don't move. The blood clot gets worse, and then it travels to their lungs. And so we always need to be thinking about how we maintain our physical integrity throughout anything that we're doing, whether we are ill or we are well, because we can make ourselves ill.
Yeah, absolutely, for sure. I know you have someone with you. We're going to come back to you, Mary Jo, but I see this pretty young girl, and her name is Jessica. And Jessica, you want to go ahead and tell me? I know you're going to Michigan State right now, and you're interning with the doctor here. So just tell us a little bit what motivated you to go to Michigan State and get involved in this profession.
Well, I have always known that I wanted to go into medicine and I have wanted to help people. So, really being able to help people in this capacity is so rewarding. And it's so rewarding to be able to see patients and hear their stories and be able to come up with plans to help them get through whatever they're going through, whether it's pneumonia or a sinus infection or more chronic issues. Being able to come up with plans that both take the patient into consideration and different aspects of their health has been an incredibly rewarding thing to see, especially going through this rotation with Dr. Volpel. Really integrating a healthy lifestyle and some of those changes that you can make is something that is very emphasized in her practice. And I think a lot of her patients really, really appreciate that as opposed to jumping straight to medications as a first line of intervention.
Is anybody in your family related into the medical field, or?
Yeah, my mom is an internist. So
Okay.
that's kind of in part seeing how she interacted with patients. One of the reasons that I really wanted to get into medicine.
Mm-hmm. And where are you at as far as, are you a junior or senior? Where are you at with that, and how's that?
I am a second year medical student at Michigan State University College of Osteopathic Medicine.
Ah, very good. All right. Wow, that's very exciting. Now, we know that Mary Jo and her husband Larry they are active. Just curious, where are you? What is your activity when you're not studying?
Well, it has been incredibly busy throughout medical school, but when I'm not studying, I really do enjoy swimming as a form of activity. And through high school, I was a competitive figure skater. So
Oh,
two different things, but both of them are incredibly enjoyable. And the best part is neither one of them requires me to run. So
all right. Hey, it's still great cardio. So, and the Olympics are taking place right now.
exactly,
So,
and they're both forms of exercise that I find enjoyable, which I think is really important, is to find something to do that you enjoy.
sure, sure. Okay, thank you. All right, then, Mary Jo, being in the insurance and just being in my late 60s and just understanding, as we get older, and we know that cancer can take place at any age. Um, it's interesting because there's so many different types of policies out there that, they're going to cover cancer, or it's the big three, right? It's cancer, heart attack, and stroke. We know how much important activity is, and I also believe nutrition is a big deal. And we all know that. It's common sense, but it's walking the talk what really matters. Sooner or later, it catches up. But, coming back to your profession, when people walk through your doors, how you're treating them. And I understand what you're talking about, but are you putting them on medications, keeping them off, or is there certain things you're having to do? And I don't know what stages they're at, because I understand there's 4 stages, and so just help the audience out there.
So the first time a patient comes in, my first question or statement to them is that my care for you may cost thousands and thousands of dollars a month. And my probability of helping you is in the range of 50%. The other 50% on the average comes from you. That's your lifestyle. That's the way you eat. That's the way you exercise and take care of your body. That does not change. Clinical studies have shown that if you don't help me, your risk factors go up by 27%. That means that 1 out of 4 times, you're going to end up in the hospital if you don't take care of yourself. 1 out of 4 times, you're going to have more complications from chemotherapy than the person who does take care of themselves. And 1 out of 4 times, when you could have been cured, you will die from your disease. Now, those statistics are pretty staggering. And I would think that whoever is listening would think, you know what? It's worth it for me to try to have a healthy lifestyle, to work on this. First of all, if I've got a chance of preventing a severe life-ending disease process by my own personal activity, why wouldn't I do it? And so what does that mean? What does the Heart Association recommend? Well, the Heart Association recommends a minimum of walking 2 miles within 30 minutes most days of the week. Now, anybody can do that. If you can't do that, you can swim, or you can bike, or you can get involved with weight training. Whatever your choices are, but it's something that you should do for 30 minutes to an hour every day, just to keep your body in shape. Now, another reason why that's important is that as we age, and that aging process starts between 35 and 40, you lose a 0.5 pound of muscle mass a year. And you're like, no, I'm 50 years old. I'm the same size I was when I was 35. I'm not losing my muscle mass. No, what's happening is that your muscle mass is being replaced with fat because you did not work your muscles. So it's something that you have to continually work on throughout your life to maintain the integrity of your body and an active lifestyle, so that when you're 60, you can get up out of a chair without pulling on the table to help you stand up. It's these simple things that come on very slowly that many of us take for granted that we really need to focus on as we age.
Yeah, with cancer. So are people already coming to you when are they already on chemo, or where are they at with that? Or
It's all different stages. Some patients have been coming to see me for the last 20 years because they are second generation of patients that I had. A second generation that listened to my statements about lifestyle and making changes. And then about every 4th or 5th person that comes in, okay, now your mammogram was abnormal. Now this is what we're going to do. We've caught it early. Prevention and early diagnosis is very important. So maintaining a relationship with the physician, looking at critically what your family risk factors are personally, and then what risk factors you personally maybe had acquired. In other words, were you exposed to Agent Orange? Were
Right.
you exposed to toxic pollutants? Was your lifestyle that of a smoker and a drinker. All of
Yeah.
these things play a role
Yeah. What
in the
about the
way.
genetics? Yeah, I'm just often, because I listen to, different types of, information when it comes to genetics. And what percent would you say are genetics when it comes to,
That's a very small role, actually,
yeah,
less than 12% on the average.
yeah,
We have markers that we call epigenetics.
yeah,
In other words, there are minor changes in our genetic system that can occur that can create a cancer, and they occur because of something we have done in our lifestyle or because of something we were exposed to. But those are all modifiable risk factors and in many cases avoidable.
yeah. I know there's different stages. Can you just help people understand the different stages?
So when you go to see a physician and you're there for preventative care, you may potentially have what we call a precancerous condition.
Hmm.
And that precancerous condition may be, let's say, you're fair skinned, blue eyed, and you have changes on your skin. And that precancerous condition can then begin to develop into an actual cancer. And that cancer, once it occurs, is stage 1 because it is localized. It is only in one area of the body, and it can be easily treated or removed. When a cancer grows and it extends to the point that it is beyond the primary location, in other words, let's say you had an area of scarring in the lung that was followed for years and years and years. And then after a couple of years, it begins to grow. That's still stage 1. If on your scans things begin to progress to lymph nodes, let's say behind your breastbone, then that will become stage 2. Extension beyond the lungs, stage 3, and then involving the abdomen, the liver, or the bones, or the brain, that's stage 4, to put it kind of simplistically. You can have locally advanced cancers, like breast cancer, that can start as something that is not palpable, an early stage. It can then become either larger and expand through the skin and form an open ulcer. That becomes stage 4 because your skin is not part of your breast tissue. It is extended into your lymphatic system, your circulation, and another big organ in your body, which is your skin. If it spreads to lymph nodes, then that's another stage, obviously. So when you consider a cancer, you want, first of all, to prevent it, and you want to look at the risk factors that make something occur. When it does begin to develop, you want to be able to identify that cancer early when it's stage 1, where it is still curable. Because once it begins to advance to stage 2 or 3 or systemically throughout your body, it is not as curable. Now, that comes to our current treatments that we're doing these days. In the past, if you had extensive cancer, you were offered chemotherapy, surgery, and irradiation, and then that was it. Today, if someone comes in and you have an epigenetic marker that we have medication for, you can have disease throughout your body. You can receive this medication. Some of them are oral, some of them are IV, and it can shrink and potentially cure cancer that has potentially spread throughout your body. There are at least 6 or 7 immune therapy agents available today that are very effective. People can come in and they can have extensive disease in both lungs. They have a particular marker. They're lucky. They go on this immune modulating therapy. It attacks directly that particular cell. and it can destroy all of the malignant sites.
Mm-hmm.
So as we go forward with more and more epigenetic markers for different cancers, we're identifying more and more immune therapies that will be targeted specifically for that particular cancer to potentially cure it. I say potentially because when we look at um, the long range goals of care, we like to say we can't assure you that you're cured from a cancer until it has been a minimum of 5 years.
Okay.
And some people
Yeah.
are suggesting maybe even 10 years.
Yeah. I can relate that to the cancer when it comes to underwriting, when it comes to, somebody applying for life insurance, long-term care insurance, same thing. Yeah. For sure, 5 years. Yeah.
Yeah, and so now with these new immune therapies, if they're out there and
Yeah.
they become cured, then how do you deal with that? I mean, is it
Right.
something that's going to become an issue
Yeah.
in 15 years? We don't know
Yeah.
that answer yet.
Yeah. It's just like John Hancock, they had that. It's called Grail. So back in 2022, they partnered with them. So anybody that has a life insurance policy with them, they can create up to 50 different detections on cancer just with a blood test, right? And so that's the first step of the prevention that's taking place here now in 2024.
Yeah, and the some in some of the journals now they're looking at. So what do we do with that information? That's
Sure.
the difficult part on the medical side of it.
Mm-hmm.
How do we counsel people on how to manage this process? You know that you're at risk. You don't know when it's going to occur.
Right, exactly.
And so, as a physician, you have to be careful in how you counsel people. It's just like if you have a family that has a genetic background for BRCA1 or BRCA2, they're at high risk. You have to have a high index of suspicion.
I don't know what that means.
So, the BRCA gene is a breast cancer gene. BRCA1 was where the female descendants all develop breast cancer.
Mm.
BRCA2 is a breast cancer gene that can take on other forms. And so that any cells within what we call our germline, so when we're developing, we have tissues that are sex organs technically, and they follow along a line that goes from the mid collarbone, mid breast, all the way down to the hips, so that you can develop a cancer at anywhere along that line.
Mm.
So the BRCA1 gene people usually develop breast cancer. BRCA2 can have a cancer that develops anywhere along that midsection area. It can be an ovarian cancer. It can be a bowel cancer, that kind of thing.
Sure, yeah. Today, so people, they go to their physician, right? And normally, it's the prevention, right? That's why you go to do your annual physical, and it's so important, right? And especially men, they say men, that they just don't want to go, and then sometimes there's the regrets when they don't go, And do you find that? What percentage of men come through your door versus women?
Well, in my case, I'm probably more heavily weighted towards women.
Yeah.
The men tend to go to a urologist,
Okay.
and then they'll be identified there. The male patients that I've had, colon cancer, testicular cancer,
Mm-hmm.
they will always come to me first. Or then when the urologist finds something, they'll come to me for advice on, do you think I should do this? Well, of course you should. I mean, why not? So there are changes in terms of your relationship with your physician and what you're comfortable with as you go through your lifestyle.
Okay. Yep. All right. Is there anything that we have missed that you feel we could cover? We have a couple minutes left, and I just before we kind of close it out, and uh, what and I know we talk about lifestyle, and it's pretty common sense, but it's sometimes easier said than done for people. But kind of like what you said, when your life's on the line, it seems like people are ready for that change, and then we know that doesn't happen. But any final thoughts on any of that?
Well, I think that activity is something that everybody says, yes, I'm exercising and doing enough. And I don't think we appreciate the importance of actually putting our body through a strenuous routine and sweating and getting our heart rate up. Many people come in to see me and say, well, I walk a couple miles every day. And I said, well, how long does it take you? Well, about an hour. I said, no. First of all, you should walk 2 miles within 30 minutes. And next thing is you should follow your heart rate. If you're not getting your heart rate up to 80% of your maximum and holding it there for 20 minutes, you haven't exercised. And if you exercise for 10 minutes, you don't get your heart rate up in a range that's going to protect you, and then stay there. So to say I'll go out for 5 minutes now, 5 minutes at noon, and 5 minutes in the evening, and that's good enough, it is not good enough. It is what's considered activities of daily living and does not strengthen your body. So you have to set aside a period of time in which you're going to make your heart rate go up 80% of your norm. So that's 220 minus your age, and then figure it out from there.
There you go. Yeah.
And hold it for half an hour every day.
Yep. Yeah. Between that and the strength, right? You have that. Yeah. Yeah.
Absolutely.
Right. Yeah. Anybody can do it. It's taking the time. There's consequences when you don't do it. Yeah.
Absolutely.
There's a price. You're going to pay the price one way or another. How do you want to pay it? So, all right. Well, if somebody had questions, can you tell me how they should contact you, or if there's someone else within the medical profession that you feel could be a good contact?
I haven't been running with the cardiologist recently, but there are some nephrologists in the area that are very active in biking and running, so that if you reach out to your family practice doctor, they would know locally for you who is already active within the community that you might be able to link up with. If you are in Oakland County,
that's Michigan.
Yeah. So if you're in this area, there is a group called the Clarkston Wolfpack Group in Oakland County, and they meet every Saturday morning at 8 o'clock, and they go for a run. If you want to walk, you can walk. If you want to walk a mile, you can walk a mile. If you want to walk 4 miles, you can walk 4 miles. You can run 5 miles.
Yeah.
You can run 10 miles.
Yeah.
You can do 1-and-1s. Walk a mile, jog a mile. Or you can jog a minute, walk a minute. Any pattern that you want to do, and there are all different kinds of groups of people available to say, this is what you want to do. Okay, I'll go with you today.
Yeah.
And they'll help you out. Sometimes a group of people helps you get motivated more than trying to do it on your own. You're not alone.
Yeah.
The Motor City has a group, and Flint has a group. And Lapeer has a biking group that meets on Wednesday night.
Yep. Yep. There's plenty of places you can plug in. Now, when it comes to if somebody has a question about, I would imagine they'd go to their family physician for their when it comes to questions about cancer or anything like that.
So your prevention and your care is always with your primary care doctor. And then you need to take that the next step further and do things on your own to help your physician help you, to help so that you don't have cardiac problems, so that you don't have a stroke, so that you stay active and strong. If you've had a problem with asthma or your breathing, strengthen your heart and your lungs through walking. It's as simple as just going for a walk. Your physician sometimes can advise you if I think you need some help in terms of knowing how much you can do and when to start and when to stop. That's also a good idea if you've never exercised before.
All right. So there you go. I know Mary Jo's just a lot of wisdom, and we're not going to get into age, but I know if I'm in my late 60s, I think you had me beat by a little bit, but we would never know it. So, right, we're blessed with good health, and we know that can change. Good health is a day at a time, no matter who you are. When the man upstairs calls us, we just want to live the quality of life that's important, and it's never too late. Jessica, we're wrapping it up here. Any final thoughts?
I just think it's so important to build a good relationship with your primary care provider and be able to bring up any concerns that you might have, because you never know, you might be able to catch something early, which prevention is key and good outcomes for a lot of the conditions that we talked about today.
Wow, that couldn't have been said better. You're being trained well, and I can tell you're going to go a long way. So good for you. You're blessed because you know what you want to do, and you're going to be helping a lot of people. So
Thank you.
Stay positive and make it happen. All right. Any questions? You can always get a hold of myself and Mary. I will connect you, with Mary Jo. Mary Jo, is there somewhere where they could reach out if they had a question to talk to you about, or someone else?
Sure. Our office is 248-391-9220. And if we're not in the office, we're dancing or running. My husband usually carries the phone, and the office flips over to his phone. So if he's busy, it'll go to voicemail, but he'll get back to you.
All right. Well, thank you both for being here, and we're going to welcome you back. I hope you enjoyed this, and make it a blessed day.